Today, I'm going to show you why your current facial protocol is histologically incompatible with darker skin tones and introduce the world's first facial formulated for skin of color to tackle hyperpigmentation, acne, fine lines, dull skin, and texture. I'm Dr. Vanita Rattan. I'm one of the only medically qualified doctors who's also a cosmetic formulator specifically for skin of color. I have treated over 40,000 cases of hyperpigmentation with a 95% success rate, and I'm also a published author with HarperCollins. To my fellow clinicians and aesthetic practitioners, you're following the gold standard. You're using the best devices. You're adhering to the exact protocols taught. Yet your Fitzpatrick patients, 4, 5, and 6 patients, keep coming back with post-inflammatory hyperpigmentation. We're taught that sensitive skin is the outlier. However, the latest data suggests that for the majority of the global population, i.e. skin of color, the standard lasers, peels, and facials are actually a trauma trigger. Some practitioners might think the adverse events are due to patient non-compliance, which can sometimes happen, or bad luck. But it turns out the biggest risk to your patient's skin is actually coming from the very tools the industry has given us. Things like harsh acids, mechanical exfoliation, ablative lasers, and of course the gold standard hydroquinone, and even normal microneedling techniques. Hey, listen, 90% of you haven't actually subscribed to this channel. That means that you're missing out on direct contact with me, because what I do is for the first hour of every video, I'm in the comment section. Plus, it means you get to join our online community in YouTube. You get to ask me questions on YouTube itself. So if you haven't subscribed and hit the notification bell, what are you waiting for? Do it now. The problem is a histological mismatch. Let's look at the epidemiology. The standard of care in aesthetics was largely derived from clinical studies on Caucasian skin. However, when we applied the same modalities such as thermal heat, ablation, and aggressive extraction to skin of color, we see a spike in adverse events. Why? Because traditional facials rely on wound healing response to generate collagen. In Fitzpatrick 1 to 3, this controlled trauma causes erythema that resolves. That's red skin that resolves. Yet in Fitzpatrick 4, 5, and 6, darker skin tones, the same trauma triggers the arachidonic acid cascade, leading directly to melanogenesis and long-term hyperpigmentation. We are seeing patients present with 5 primary concerns: hyperpigmentation, acne, dull skin, fine lines, and texture. But traditional solutions like steam, harsh peels often exacerbate these exact issues. Steam dilates blood vessels, worsening inflammation. Deep peels damage the deeper dermal layers, leading to PIH. Hydroquinone is cytotoxic, poisoning the melanocyte, which leads to rebound hyperpigmentation once it's stopped. This isn't just a beauty issue, it's a medical incompatibility. To understand the solution, we must first accept the physiology. There are 3 critical histological differences in skin of color that dictate why we must change our approach. Difference number 1, the melanocyte biology. We know that melanocyte density is roughly consistent across all skin types. However, in skin of color, the melanosomes are larger and loaded with more melanin. They are biologically hypersensitive. The threshold for triggering tyrosinase activity is significantly lower. This means that minor trauma, even from the heat of steam, can trigger a disproportionate melanin response. Difference number 2, the stratum corneum. Skin of color typically possesses a thicker, more compact epidermis. This increased density makes it physically harder for active ingredients to penetrate effectively. Yet this same density means that physical scrubs or microdermabrasion often cause microtears rather than even exfoliation. This increases the risk of irritation and inflammation. Difference number 3, your ceramide deficiency. Studies indicate the skin of color contains fewer fatty ceramides. This results in a compromised lipid barrier and higher transepidermal water loss. That's water evaporation from the skin. Clinically, this presents as ashy or dull skin. Standard protocols that strip the oils, often used for acne, destroy the already fragile barrier, leading to a feedback loop of dehydration and dullness. So what's the solution? We developed the Dr. Vanita Rattan Glow Facial Treatment to solve these specific physiological challenges. It's a 50-minute, 5-step protocol designed to deliver results without triggering the inflammatory cascade. Step 1, lymphatic drainage, not extraction. Instead of aggressive extractions which rupture the follicle and cause scarring, we utilize facial cupping for lymphatic drainage. This boosts circulation, which prepares the skin for actives. Step 2, radiofrequency sequencing. We utilize radiofrequency to stimulate collagen and tighten the skin. However, the sequence is critical. We perform radiofrequency before microneedling. Why? Because if you create microchannels first and then apply heat, you risk unpredictable thermal injury, hotspots in the dermis. By doing radiofrequency first, we treat the dermis safely. Step 3, the glow peel, large molecule exfoliation. We strictly avoid small molecule acids like glycolic acid or TCA, which penetrate too quickly and cause hotspots. Instead, we use the glow peel formulated with mandelic acid and lactic acid. These are large molecules that penetrate slowly and evenly. We combine this with tyrosinase inhibitors such as kojic acid, ascorbic acid, phytic acid, and ferulic acid to proactively calm down melanin production during the exfoliation process itself. Step 4, microneedling with the glow serum infusion with small molecular weight actives. This stimulates collagen plus creates channels for the tyrosinase inhibitors to penetrate deep to where the melanocytes reside on the epidermal dermal junction. We use skin of color safe ingredients: tetrahexyldecylascorbate, licorice root extract, peptides, bakuchiol, and phytic acid. We also added in oligopeptides and DNA repair enzymes to penetrate deeper into the skin. This step tackles hyperpigmentation, fine lines, and acne. Step 5, occlude with our stem cell sheet mask, the glow mask. This reduces inflammation rapidly post-procedure, plus allows the peptides and ceramides to penetrate deep into the skin to give you a glow finish 24 hours later. We combine this with a cooling device to create instant vasoconstriction. It calms down any potential erythema immediately. Let's talk about the things that we make sure are not in this facial. Number 1, the steam prohibition. We've completely eliminated steam from this protocol. Steam causes vasodilation, which recruits inflammatory mediators into the area. Instead, we use a handheld fan humidifier. This provides evaporative cooling and hydration without the thermal trigger. So let's talk about outcomes. By respecting the histology, the outcome changes drastically. Number 1, we use large molecular weight acids to avoid deep trauma. There's minimal to no downtime. Compare this to traditional peels where patients may shed or remain red for weeks. Number 2, we replace ceramides deeper into the skin post microneedling. We repair the barrier immediately, stopping transepidermal water loss. Number 3, the entire range is NAEF safe. No denatured alcohol, no fragrance, no essential oils. We eliminate the primary triggers for contact dermatitis. This protocol has been clinically tested on hundreds of candidates of skin of color to ensure efficacy of our top 5 concerns. As professionals, we want to give our patients the absolute best and up-to-date technology based on the latest data. We're inviting clinics to become certified practitioners of the Dr. V Glow Facial Treatment. This training provides you with exclusive professional-only products, the Glow Peel, the Glow Serum, and the Glow Mask, and the certification to market yourself as a specialist in skin of color. The link is below. You can sign up for your clinic to be verified, to get territory exclusivity, and to join our Skin of Color directory, which our 3.5 million followers can then access. You also receive your online training and can start straight away. If you're a patient and want to have access to this facial, I highly recommend you show this video to your favorite clinic, and we'll do our best to provide for them.